Hi, Kathy. How are you today?
I'm good. How are you?
I'm doing well. Thanks for asking. How's the medications been treating you?
It's going really well. I think this is the only thing that's really worked for me, and thank God for that Xanax. I couldn't get through the day without it. So, and that reminds me before I forget, I do need my refill. I know I usually don't get it refilled until 2 weeks later, and I'm a little early. But with the holidays coming up, I'm probably going to be out of town, and it works so well, I don't want to be without it.
Okay. What do you think you're going to be out of town for? For how long of a time?
Well, I'm not really sure because I think I'm going to go over my sister's, but then after that, I may be going to visit my aunt. So I could be gone anywhere between 1 and 3 weeks. And, I mean, I don't want to run out. So I could be back in time, but I'm not sure. So just so I don't skip, because I know it's really dangerous to skip days.
Mhm, mhm. Okay. And will you be in like larger cities that you're visiting your family in? Will there be like the CVS or Walmart or Walgreens around any of those stores?
Well, I'm sure there will be. I mean, I'm just not sure if I'm going to be able to get there because, I mean, it's really busy around the holiday times, and I may be out shopping, but it'd probably be with other people. And, we've talked about my family before, and with shopping, it's hard for me to get in edgewise where I need to go. So I think the easiest thing to do would just be to fill it early.
Okay, you're thinking like 2 weeks early?
Yeah. Yeah, I think that would work because, I mean, I'm not going out of town for another week, but I have to pack and all this, and I don't want to, forget to fill it.
Okay, and it looks like here you're about to you're due for a refill in about 2.5 weeks, right? So that's probably about 20 pills. How many pills do you think you have left right now?
Well, I know I'm supposed to take it. It I don't have my prescription with me. It's like 2 to 3 times a day, right?
I've prescribed it for you twice a day. Yep, that's correct. So
Oh, I
60 of
thought it was twice a day, but 3 times if I'm having a really rough day. So I've been having a really hard time at work. So the last week I have been taking it 3 times a day. So I I'm gonna run out early anyway. But are you sure it's just twice a day?
Yeah, it's pretty clear on the bottle. It says 1 milligram twice a day as needed for anxiety.
Well, see, it's as needed though. But
But up,
doesn't as needed mean when I need it? Because I mean, let me tell you, a couple of weeks ago, I needed it about 4 times a day because it was a really rough time.
does that happen pretty often? Does that
Yeah,
happen?
it does. And I was going to talk to you about that. I think that we have to go up on the dosage because that 1 milligram just doesn't seem to be doing it anymore. Is it possible instead of me taking the 1 milligram 4 to 5 times a day, that you prescribe 2 milligrams maybe 3 times a day? I think that might work better, especially with the holidays coming around.
That's a lot of medication. What about the Lexapro that we started a couple months ago? You still taking that?
I am taking that.
Okay.
Um, Now, I don't know how it reacts with the Xanax, but I meant to talk to you about that too, because I've been noticing that lately, a couple times a week, I'll have to double up on my doses with the Lexapro. It just seems to work better. I don't know why.
You've been taking just doubling up a couple of times a week? So just here and there, not every day? Okay.
Well, maybe 3 or 4 times a week. Just like on work days.
So that's a medicine that actually you want to keep consistent and not increase and decrease like that because that actually can make some of your symptoms worse. It's a
Well, that's
medicine that
probably
builds up
why.
slowly over time in your system. But even at the 10 milligrams, that should have been helping with some of the depression and the anxiety. And with the Xanax, um, you know, the concern is that the most it could ever be dosed at, Kathy, is 4 milligrams a day. And so if you've been using it 4 to 5 times a day, I mean, that's kind of scary. And wanting to increase it to 2 milligrams several times a day, well, that, can really get into some dangerous territory. Xanax is actually supposed to be used no more than 6 months, and we're already past that. We're actually going into 7 months right now, and we haven't seen a decrease in the anxiety, only that it's gotten worse and worse and worse. And so I'm concerned about it being effective for your anxiety, because if it was effective, we should see the opposite. We should see you feeling less anxious instead of having to use it more. And the thing about Xanax is it can become very habit forming, and the body quickly gets addicted to it.
Are you calling me a drug addict?
Not at all. Saying that the
Because
body.
it sounds like you're blaming me for. I mean, I looked up on WebMD, and they said that different people react differently with medication, and it could be that I'm just the type of person who needs more. Like when I have pain, I need more stronger medication to deal with that pain. So I think I need more stronger medication to deal with my anxiety. Is there something stronger than Xanax that I can use? Because, I can't get through the next couple months without something.
And that's understandable. I mean, I definitely think that you experiencing a lot of anxiety is a legitimate concern. I just think that we need to use non-controlled substance measures where we're looking at the long-term medication. So maybe adding more medications to the Lexapro and increasing it to 20 milligrams every day. And then maybe adding in things like some Remeron for sleep, which is a non-controlled substance to kind of help your anxiety while you're sleeping and when you wake up in the morning. And also look at some other options besides the Xanax, like Vistaril. It's also known as hydroxyzine, given a couple of times a day as needed to kind of offset some of the feelings that you're having.
But you know what? You're talking, first of all, Xanax is the only thing that has worked for me. I've had anxiety for many years, and Xanax is the only thing that's worked. And now you're talking about, first you call me a drug addict, and then you're talking about taking the one drug that works for me and putting all these other drugs on me. That can't be healthy. I mean, what's the point? If Xanax works for me, what kind of you're not even a doctor. What kind of nurse are you to take me away from the only thing that works for me and put me on all these other medications that may or may not work? And I read on WebMD, you shouldn't be taking all these medications. You should only take one or two. And it doesn't make sense. It doesn't make sense.
I understand that you're frustrated, Kathy, and
I am.
for it is because Xanax is only intended to be used no more than 6 months at a time, or period at all. If you look at the insert, the big white piece of paper that's bundled up, stuck to the bottle, it actually tells you in there that you should not use Xanax for more than 6 months. And studies that have come out recently have actually shown that people that use it over 6 months, any of the benzodiazepines in that class, so including Ativan, Valium, Klonopin, Xanax, all of those can actually cause early onset dementia, which is a permanent damage to your brain. And I don't want to be that person that, even though, you feel that it's helpful, I still hear that there's still some anxiety, lots of it. So I don't feel the medicine is effective, and I don't also want to be responsible for you to have early onset dementia if we continue to use the Xanax.
But it's a benzo, and if you take me off a benzo, that's really serious. That I read that insert, and they said if you take someone off it, it could cause seizures, it could cause death. I mean, wouldn't you rather me take something for more than 6 months than I die of a seizure? I mean, I don't know what kind of nurse you are or where you studied.
I'm frustrated, but that has nothing to do with what the discussion we're having right now. And so basically what I want to say is this, is that due to you having to use more of the medication and using it more than I've prescribed, I'm now concerned that we need to back down and start tapering down the Xanax, because I feel that your body has become physically dependent upon it, that you're having to take more and more and more, and you're asking for more today. And that's very concerning to me. So what I'd like to propose to you is that we work together to go slowly down off of the medication. It's called a taper. We can do that over the next several months. We do it at 25% of the medication each month, so that it's very slow and gradual, so that you won't have seizures, so that you won't have any kind of adverse effects from the slowly decreasing of the medication. And you're right, if you take the medicine and you stop it abruptly, it can cause withdrawals. Now, no one ever really dies from a benzo withdrawal, as the seizures are the concern. Yes, that's true. The other thing we can do is we can add a seizure medication so that we can prevent those things from happening, which would also help with the mood, because we use seizure medications for mood stabilization as well. But it is my final decision that I do believe we need to taper down and start you on some more long-term medications to get this anxiety down, so that you can go on vacation and enjoy your time without having to feel like you're stuck with the Xanax bottle all the time. My hope for you is that you'd be able to really enjoy your time and be able to function in situations where you don't have to feel tied to a medication.
So you're not going to just cut me off.
That's correct.
Okay, I'm sorry. I'm sorry I yelled at you, but my anxiety.
That's okay.
So you're not going to just cut me off, and you're going to change to something else.
Yep. And we're going to work up something else that's not a controlled substance, that doesn't cause this physical addiction, so that we can ease down some of your symptoms while we're slowly going down off of the Xanax. So it's kind of a nice, we call it a cross taper. So as we build up the long-term medicines that work well to decrease the anxiety, we'll slowly come off of the Xanax. So it'll be a nice, clean transition with no side effects. That's the goal, or very little side effects.
Okay.
I think that's the best way to do it. You have options. If you not want to do it that way, you're more than welcome to find another provider. You're also more than welcome to just, start with a new practice or ask for a switch. And I think it's the best thing to do. We can work together on doing a slow taper. Very clearly sit down and work out a schedule with you, so you and I both know in writing what we've agreed upon today. And that's the 25% reduction. Okay, so every month it will go down slow, and then we try different medicines. We work on doses to really get you feeling good, where you're not having to be tied to that. I think that's a good goal to reach. And we can also look at other medications that are similar, where you're taking them as needed on those days that you have that breakthrough anxiety, that aren't controlled, that aren't going to cause withdrawal and seizures and things like that. How does that sound to you?
Okay. So you're not calling me a drug addict. It's not my fault that I have to take more.
Correct.
And you can give me something instead. We can cut down on the Xanax, but then you'll build something else up that's not going to make me a drug addict, but will help with my anxiety.
Absolutely, and not cause early onset dementia over long-term use.
Yeah, I don't want that. I'm forgetful enough as it is. Okay, so we're going to start this month?
I think so. As soon as the next prescription runs out, which is, I think we've got another 2 weeks. And so right before you go on vacation, we'll talk about doing the 25%. So you'll still have the prescription to take with you when you go see the family. It will be slightly reduced. And we'll talk about how we can, what you can do is you kind of just mentally picture yourself, okay, so I have this amount of pills I can take, every other day. Try to manage some of the anxiety and use some of those coping skills you've been learning through therapy.
Well, I did learn some coping skills. I did learn some things to do when I get anxiety and how to feel like that. The pills were just easier, but you're going to give me something. So when you reduce this 25%, you're going to give me something else to take. So I'm not just like.
Absolutely. I'm going to give you something take as needed. That my goal is maybe you can take between the Xanax. So, you can take the Xanax a couple hours later. If you're still feeling that anxiety, you take the hydroxyzine.
Okay.
And then also we're going to look at taking a long-term medication. So we're going to start with consistently taking the Lexapro at 20 milligrams a day. And then we're
Okay.
going to add in that Remeron a little bit at bedtime just to help kind of ease off some of the sleep anxiety and help with that panicky type feeling that you feel in the morning.
Oh, so I won't wake up all panicky?
I'm hoping so. Yeah.
That's good because I wake up in a panic and I gotta grab that Xanax before I can even get out of bed.
And so to be nice, if you can reduce some of that, then that morning dose that you take can be part of what you save for when it kind of breaks through. And every month as we work together, we're going to work on getting that breakthrough anxiety to be less and less so that your use of the Xanax will be less and less rather than needing it more and more.
So you're gonna help me with this. You're not gonna report me as a drug addict and then just cancel because one of my other therapists did that. You're not gonna do that. You're just gonna work with me for another one.
Absolutely, because it's a physical dependence. The body chemistry gets addicted to the medicine. It's not your choice. It physically happens. So we want to slowly back down off of that so we're getting away from that risk factor. So absolutely. And we'll work together to write out a plan so we both know what we agreed upon today.
Okay. Okay. I think I can do that.
That's great.
Okay.
I'm glad to hear it. Well, let's get started.
Okay. Thanks. That was good.
You always act so well. You should be an actress.
I just got into it.
It's like the things I hear every day is it's the only thing that works for me. Who are you? You're a nurse? Like, what do you know?
I know. Oh, that was awful.
Every day. Who do you think you are?
Then I was trying to, after I lied my butt off, I'd be like,
I always hate that I hear so that none of that stuff really gets to me when they say it. It's when they go, well, Dr. Jeffrey, he knew what I needed. And he's not a doctor, he was a nurse practitioner. His name is Jeffrey. And it just, yeah, his last name is Jeffrey. And so they all call him Dr. Jeffrey. So I think he was telling people that he was Dr. Jeffrey. And we'd write the prescription in the computer 1 month, and then he'd write paper scripts and give them 5 months of benzos and Adderall. It's wild. I mean, I've been fighting to get him reported for a while, so.
oh my gosh, crazy.
What do you know? Dr. Jeffrey cured me.
He's a good doctor.
He should have.
You don't know what you're talking about.
And I'm like, well, he's not a doctor and he doesn't work here anymore.
I had a patient who came into the ED one time and said, now I am a recovering IV drug user. So if they give me any pain medication, it's going to have to be IV and it's going to have to be Dilaudid. And I'm like, okay, so you're coming in here because you broke your finger. I'm not real sure that's going to happen.
We used to get them, they come in and they call it Dilala.
Dilala.
Dilala, and they know exactly 2 milligrams, Q2 hours. Like they say it, like I'm just like, really, really, yeah. Now the new thing is they're chewing up fentanyl patches. They're getting fentanyl patches and eating them.
We had that.
Eating them up. Oh.
I had a fit the other day because I had to go and have a liver biopsy. And when I talked to my doctor, he said, oh, they'll just give you a local and, because it's just that needle biopsy. Well, I didn't realize when I went in, the nurse is like, well, let me start an IV. And I'm like, why do I have an IV? And she said, well, I'm going to give you something to relax you. And I was like, okay, could I be more relaxed? I'm like falling asleep here. And I didn't realize till I got my results, which by the way, I'm no cirrhosis. I'm like a little fibrosis. So he's like, oh, we caught this way early. And they printed out an extra lab report. So she's like, do you want this? And I'm like, yeah, I want to see what my liver enzymes are. But they gave me Versed, which I figured they did, and Dilaudid. And I was like, why? This is why I went home and I couldn't function for 2 days. I'm like, why did you feel the need to give me this for something that basically is just like getting a shot?
Because they can bill for it.
Yeah, I thought this is why we have all these opioid addicts, because you're giving all this stuff.
Because you can bill more for it. Yep.
Yeah, I was like, I don't need this.
Oh, so
Okay, anyway,
all
bring
right. I'm gonna be Kathy now.
it, Kathy. Bring it on. Okay. Hi, Kathy. How are you?
I'm good. How are you?
I'm really good. Um, One of the things we need to talk about today is your Xanax that you've been taking.
Hmm.
And I was looking over your records, and you've been taking it for 7 months now.
Yeah, and
Well, one thing I don't know if you remember we talked about when we started you on Xanax was that we really don't want to go beyond about 6 months with it. So, what I want to talk to you about today is tapering that off and starting you on another medication that will help with your anxiety. But the problem with Xanax is if you use it for much more than 6 months, it can become addicting. So, we don't want to run that risk. And I wanted to talk to you today about tapering off your Xanax and starting you on something else.
I need it. I mean, that's the only thing that works. Like, you've tried me on all these other medicines. I mean, even right now, just thinking about this is just really getting to me, and I
I
feel
can
like
see.
explode, because that's the only thing that works for me. Like I have to have this. And actually, I was going to talk to you today about increasing it because, just 1 milligram twice a day is just, I've taken 2 milligrams 6 times a day before from the last doctor that saw me. So I just don't get why, you have me on this baby dose and now you want to like wean me off. Like I can't even sleep. I can't even eat. I can't even function without this Xanax. I have to have it. You just have to give it to me. There's just no way around it. Nothing else works.
I understand your concerns, Kathy. What I'm concerned about is once you're taking it for that long, and you've said you've taken it before with another doctor, we can run into some problems. And one of those is that the maximum dose which you're on no longer is enough, and you need more and more. And it's going to be too much for your body. I know you're feeling relief from your anxiety, but it's just not safe to take much longer. So I wouldn't be doing my job unless I talk to you about this and talk to you about some options. There are some other medications we can use that can help with the anxiety that are safer for long-term use. We're not going to cut you off to cold turkey. We're going to taper it down. So
What if
while
I
you're
die? What if I have like a seizure? Like the last time that doctor gave me like all that, it was like 2 milligrams, like 6 times a day, and then I didn't get a script, and I had to wait to get in here to see you guys, and it was awful. Like I was like having seizures and stuff. I had to go to the hospital. Like it was really bad. He almost killed me.
Oh my goodness. Well, there is a risk of that. And what we can do to be preventive is give you some anti-seizure medication
Mhm.
so that you won't have a seizure. It's very unlikely that tapering down off, it's the safest way to do it. It's very unlikely that that would cause seizures or death. But if you've had seizures in the past, we can give you some medication to help with that. But I just want to be real clear. We do have to taper down off that. So right now you have a choice, because you always have choices. If you want to continue with me, we'll work on this tapering down. We can talk about that more. If you feel strongly that you need to have the Xanax, I'm afraid I'm not going to be able to do that. So you have that choice.
So you're just gonna leave me with nothing? I mean, if you're just cutting me off, like I can't do that. I've been on this stuff for years. It's been
No,
great for years.
Kathy, that's not my plan. My plan is not to cut you off. My plan is to taper you down safely, and then to start you at the same time as you're tapering down, to start you tapering up on another medication. I'm thinking Visceral will probably work. Have you taken that before?
No, no, I haven't tried any of that stuff.
Okay. Well, we can try that, and we can start you off with a low. Remember, go low and slow, a low dose so you're basically transitioning,
Okay.
okay, from the Xanax to the Visceral. And we'll continue to monitor you for that. We'll continue to talk. Now, I wanted to add too, this is not the only tool in your toolkit here, because you've also been working very hard on some non-medication ways to deal with your anxiety.
Yeah, I've been working
And
with that therapist weekly. I mean, that's been helpful. It's just,
good.
the Xanax, I mean, like, when I know it's like time to take another one, if I miss that, like, I start to physically feel sick. Like, I just don't want that to happen. I don't really feel comfortable taking other medicines, like seizure stuff, because that sounds scary to me. But
Yeah,
I mean, like, how soon are you going to be cutting me off of my stuff? Because this is really stressful. Like, this is just causing me anxiety.
I can see. I can see it's causing you anxiety. But remember, we're not cutting you off. We're not just saying, that's it, no more.
Okay.
Some of the things that you're describing, you just told me that if you don't take it on time, you feel physically sick.
Mhm.
That's a sign of a dependence. Because what happens is with Xanax, it works really well, but if you keep taking it for too long, it causes a change in your body and your body starts to depend on it. So you do get sick when you don't take it. And I keep up with the information on this. One of the things that they found with Xanax is if you take it too long, it can cause Alzheimer's.
Mm, okay. Yeah,
So we don't want that.
I'm already old enough. I feel like I've stuff enough. But I mean, I just, I don't want you to think that like I purposely, just want to use it all the time. It's not like I'm a drug addict or anything. It's just that this is the only thing that's worked. I mean, that doctor was giving it to me for like 15 years. Like, this is really hard for me to think that you're going to yank what works for me away. That's pretty tough.
I understand that because um, it's what you're used to. It's what has worked. But 15 years is a way long time to take it.
Yeah.
And with any medication that you take for that long, you run the risk of you need more to have the same effect.
Yeah.
And too much of a good thing is not good, right? So what I'd like to do is to switch you from Xanax, which works really well short term, like 6 months, but not so good 15 years, to something that you could be taking that long. Visceral is something that is safe for you to take long term. And we're not cutting you off.
Okay.
We're saying let's taper down. So like you're taking 2 milligrams a day, right?
Uh-huh.
So we would probably cut down to 1.5 milligrams a day. But at the same time, we would add some Visceral.
Okay.
So your body is still getting that effect. Now you may feel some symptoms because you've been taking this for 15 years. But you're also working on those non-pharmaceutical ways to deal with your anxiety.
Okay.
And you've been doing really well with that.
So how long will we do like the 1.5? Like, will that be like a month at a time or?
We would probably, because you've been on it so long, we'll probably try that for about a month and then go down to 1 milligram for about a month. But as we go down to 1 milligram, we're going to increase your Visceral. But these are things that, or sorry, Visceral. These are things that we're going to monitor. You're going to keep coming in. We're going to talk about how it's going.
Okay.
Um,
And keep doing the therapy and stuff too. I mean, I'm cool with that. Like, that's just a little bit. I think that's reasonable. I
you
just
think
don't
it's
want to
reasonable?
be
Good.
yanked off like I was last time. I mean, that was really bad. I ended up in the hospital. I don't want to be doing any of that.
I don't want you in the hospital either. Um, these medication changes so much. And in the 15 years that you've been taking Xanax, there have been a lot of new medications. There's also been a lot of new research. So we want to keep up with what's going on. And I want you to, when we start on the medication, remember we talked about how it's the quickest, most effective way to make a change. But there's other ways to make a change. And you've been going to therapy for a while now.
Mhm.
And I don't know if we talked about this, but going to therapy can make the same changes in your brain that the medication does. It just takes longer.
Okay.
So when you're going to therapy, this is also something that can help you with this anxiety. So we're attacking it a bunch of different ways, but we're not going to cut you off to cold turkey.
Okay.
We just need to look for a healthier way to do this because it's easier to deal when your body's healthy, right?
Yeah, and I mean, when I was taking it like that 6 times a day, I mean, I felt pretty drugged up and foggy too. Like I mean, I do notice that's better. It's just the anxiety's pretty bad. But I mean, I'm not happy with this. Don't get me wrong.
I
I'm
know. I
really
know.
this, but I mean, if that's what we got to do, then I guess that's
Yeah.
what we got to do.
Well, the idea behind the medication is not to take away all these problems. It's to help you kind of take the edge off to help you deal with them a little easier. So it's not meant to be the only thing that you use. It's just meant to make it a little easier to use the other techniques that you have learned. So that way we're attacking it two different ways instead of just one. And the hope is long term is that we can even get you so you don't need so much of this medication. Now that's long term. Don't think I'm going to say Visceral 6 months, you're done. We're not going to do that.
I mean, it's hard for me to get like why I've been on it for so long. It's worked, and nobody said nothing. And now all of a sudden, it's got to be, kind of messed up. But I mean, we'll try
Yeah.
it your way, I guess. We'll see how it goes.
Well, that's the thing is we're going to see how it goes. Okay. So you remember when we first started, we talked about your job and my job, right?
Mhm.
And my job is to look out for these things and see what medications can work. Your job is to try it. So if we're cutting down and it's not working real well, we're going to talk about other things that we can do. But we need to get to a place where you're taking medication safely, that it's not going to run a risk of being bad for you in the long term. We want this to be helpful, not something that will be too risky. And at this point, the Xanax is probably a little too risky.
Okay.
Okay. So, what do you think about this week? We'll try it. We'll try cutting down because I know your prescription's coming due. We'll cut down to 1.5 milligrams a day, but then we'll add the Visceral. And then you come back next week and let me know how it's going.
Okay. I'm just hoping I don't have to buy any off the street to feel better.
Okay, well, I'm going to remind you about that too. Remember when we first started working together? I said, I work alone. I can't work with somebody on the street. Okay?
I mean, I'm going to try it your way, but I'm just
Okay.
saying, if things get bad, I don't want to just relapse or end up in the hospital. So I'm hoping that
Well,
this helps the anxiety your way, that we don't have to do that.
if things get that bad, I do want you to go to the emergency room. Okay? I don't want you to get something off the street because you don't really know what you're getting.
That's true.
Okay? And there's no complaint department when you get something off the street that's not what you want. So if it gets that bad, you have our emergency number, or you can go to the emergency room. But please don't buy anything off the street. I don't work well with other pharmaceutical people.
Okay.
I only work in the legit.
We'll try it your way.
Okay. But thank you for being honest and telling me that you're thinking that might be an option. Just please, before you take that option, call me or go to the ED.
Okay. Okay. All right.
Well, let's get you set up. Oh, thank you for throwing that in at the end.
That's like the
I
thing.
hope you don't lead me to a life of crime.
Yep, that's happened